Hi, my name is Erica Warlick. I'm a hematologist-oncologist at the University of Minnesota, specializing in the treatment of myelodysplastic syndromes and myeloid malignancies. For high-risk myelodysplastic syndrome, the standard first-line therapy is to use hypomethylating agents. These are either azacitidine or decitabine therapy. These are slower-to-act chemotherapy drugs, so it typically takes anywhere from 3 to 4 months before we know if someone is going to have a response. We can continue to treat patients up to 6 months' time, and at that point, if their transfusion needs haven't improved, if they're still having infections, if they don't have improved blood counts, then we really say that the hypomethylating agents are not working and we need to find another option. So unfortunately, for patients who have not responded to hypomethylating agents or whose MDS has not responded, there are no good standard second-line options. We only really have 3 FDA-approved drugs for myelodysplastic syndrome. So for patients who have progressed on standard first-line therapy, azacitidine or decitabine, we have to figure out a next step. The prognosis is not good if we don't go on to additional therapy. So for high-risk MDS patients whose MDS has not responded to hypomethylating agents, the next step really depends on what the patient goals are. If the goal is for potentially curative therapy with a stem cell transplant, then I will consider doing induction chemotherapy like we would use for acute myeloid leukemia. However, if the patient's goal is to control the MDS for as long as possible with a good quality of life, then the next step really is to look at clinical trials. The only way we're going to get better treatments for MDS is to study new therapies. And if we only have 3 FDA-approved drugs for MDS, then we need to develop more. So clinical trials are really the way to go to find the next therapy for patients. There's a great website called clinicaltrials.gov that actually lists all of the clinical studies that are being done. And that's where I typically go next to figure out if my patient has an option either at my institution or at another institution around the country.